Or Hi, everybody. Thank you so much for joining us today. If you're here live or if you're watching this recording, I'm really happy that you made the time. Let's start first with introductions. My name is Dr. Prisacari. I am an adult psychiatrist. I run ADHD Alliance of Minnesota. I'm located in the Twin Cities. And this is a workshop called Mastering Adult ADHD. I've already seen some people introducing themselves in the chat and keep that going. So if you are new here, if you're just logging in, go ahead and pop into the chat. Give us a little brief introduction about yourself. This workshop is being recorded so that folks that couldn't join us live could watch it later. Now, the questions are definitely welcome. Please let me know what kind of comes up as we go through things. If they're in the chat, I may not be able to see them until afterwards, but we'll definitely review all of them. And I've built in time for a question and answer section at the end so that it could be more interactive. All right, let's get started. Today's objectives. I want to really focus on 5 evidence-based CBT tools that you can use day to day. So our biggest focus is going to be actionable steps that you can take away from this presentation. I want it to be full of tips and things that are going to be really helpful. I also want to really integrate the measurement-based care and why that's important. So for anybody here that's a therapist or that is a mental health provider, I want to reiterate the importance of monitoring progress of our clients. We're going to talk about multimodal treatment, what that means and why that's important. We're going to talk about little modifications or adaptations for when we work with ADHD adults that are high functioning, and also track functional outcomes over time so that the different scales or measurements that we do are not just a snapshot at the beginning, but also as our care continues. All right. So adult ADHD, although it's become really trendy in the media and a lot more people are talking about it, the treatment for ADHD in adults still is not that great. Now, adult prevalence of ADHD is about 2 to 5%, depending on who you ask. Sometimes it's estimated to be a little bit higher than that, 7 to 8%. But in high functioning professionals, it's still underdiagnosed. We'll talk more about why that is a little bit. Medication does help with core symptoms. And so you were hoping that, like the psychiatrist in the room would say, that's all you need. So you just need the medication and you're good to go. Fortunately, that's not the case. There's often functional impairment that still persists despite medications. And that's where the skills-based treatment really is necessary. And the whole reason for why we're talking about it today. So I want you to really remember that despite medications improving things, there could still be residual executive dysfunction. And if you're an adult living with ADHD, whether you're on medications now, previously tried them, or thinking about trying them, know that while they do help, it's not going to be a magic pill that's going to solve all of the ADHD issues. So the main idea here is that even though medications can help reduce symptom burden, it doesn't mean that you function at 100%. The functional mastery here they're referring to is ADHD being totally gone or your optimal performance. So our goal is to move from being just overly distracted or hyperactive to being a more kind of reliable in control version of yourself that you can predict that if you do have a project or a deadline in real life, you'll be able to execute it. And that kind of self-awareness and that trust in yourself is super important. What do people with ADHD struggle with? Well, we got executive function. That includes planning, prioritizing, following through, and emotional regulation. And that's exactly what CBT for ADHD targets. Now, if you're not familiar with the term CBT, it's cognitive behavioral therapy. It is evidence-based, well-researched form of therapy that has been widely used for all kinds of mental health conditions, depression, anxiety, PTSD. Um, but here we're specifically talking about how can we use CBT for ADHD symptoms. So here it's not just talking about insight. Most ADHD adults, by the time they come see a professional, already have great insight. They've already looked up. They symptoms online or talk to friends or family, especially if they've already gotten the diagnosis, they've gotten some sort of understanding of how it's affecting their life. Now they're looking for strategies, they're looking for skills and systems to improve their performance. A graph I got here is directly from a randomized control trial published in JAMA now 16 years ago, but still considered a good visual representation for how CBT can be used for ADHD adults. So we got self-report symptoms, we got relaxation here as our placebo group, and now CBT does help. And there's some much better visuals than this, but this is just kind of a very easy to understand one. Let's talk about ADHD as executive dysfunction. So this is the main big picture here, right? Let's zoom out. So if we talk about executive dysfunction, what do we mean by that? Because that term is often used in like social media posts as kind of a hook or a hot topic, right? To get you to kind of click on their post. So, Dr. Barkley published in 2016, 10 years ago now, kind of dividing ADHD into these five functions. There's, of course, the inhibition, which could be kind of the hyperactivity, working memory, task initiation, planning, and emotional regulation. So, what he argues is that ADHD is not just about hyperactivity or inattention, it's about regulating oneself. So, how do we understand what's important? What do we need to be working on? Are we aware of the time, of self, and of motivation? And what he argues is that medications, while helpful as a key intervention, it's not by itself enough. We also need to make environmental accommodations. Um, and so effective management requires that we make motivation external to ourselves because that internal motivation in people with ADHD can be really unreliable. So why does CBT work so well in ADHD? CBT provides compensatory scaffolding, which is a fancy way of saying that if your brain needs a little bit of help, it's creating an adaptation. It's creating a easier way for it to struggle less. So what we know with ADHD is our working memory is not perfectly reliable. So let's create a system so that we can externalize it and make it more reliable and predictable than just relying on ourselves to remember it. Let's reduce avoidance by using behavioral activation. Let's use stimulus control to reduce distraction and build repeatable routines so that we lower our cognitive load. It sounds really fancy, but we're going to go through these individually by really breaking it down into the tools. And I want you to really see how usable it is, how user friendly it is. So the visual here, I want you to kind of think of two pathways, right? We got on the left, we got the medication in red, and it does reduce core symptoms, and that's wonderful. But we got the CBT skills on the right. That's what we're talking about today. With these skills, we've really improved the routines and the systems so that our life flows easier and more reliable, more predictable. It gives us better bandwidth to deal with any obstacles or additional challenges, and it just provides that functional recovery so that our day is not so challenging and overwhelming with ADHD symptoms. I wanted to kind of include a little example. Let's pretend that we have a client in front of us. This is Dr. A, which could be a 38-year-old licensed therapist who's diagnosed with ADHD and attentive type. So this is a professional, right? Somebody that is working and seemingly doing well. Now, this person is already on stimulant medication. However, behind all of that, still struggles with deadlines for documentation, avoiding large tasks like big projects, maybe at work or at home, feeling chronically overwhelmed, right? At risk for burnout. PHQ-9, which is a measure of depression, is at 10, kind of mild, moderate. Anxiety score is an 8, also mild, moderate, which kind of gives us this picture that even though this is a high functioning individual, doesn't mean that they have low impairment. They're still struggling. So what is measurement based care. This is a way to give a number to the symptoms or the impairments that we are observing. Um, in the medical field, a lot of our specialties, let's say you go to a family medicine doctor or internal medicine doctor, they're going to do blood work, they're going to do scans, they're going to be able to give a specific number to, let's say, your TSH, your thyroid hormone stimulating hormone. They're going to give you a number. Oh, it's a high, it's low. Let's see. Let's say you get a CT scan. They're going to be able to visualize and measure any kind of dysfunction there. But in psychiatry, we don't have that. And measurement-based care allows us a proxy so that we can track it over time too. So it's essentially a questionnaire, a form, some kind of a scale, so that we track the progress. It makes it observable. It makes it also so we are less likely to have that confirmation bias where the clinician and the patient can just say, yeah, I think I'm feeling better. I'm 100%. Hmm, let's really look through each of the categories. And it helps us clarify differential diagnosis because what if that's not the whole picture? We'll talk about that in a minute too. So it's a systematic way to track symptoms, function, mood and anxiety, and to help guide our approach to treatment. One of these scales is called ASRS. You're probably familiar with this one. If you haven't yet, then you will be soon. Adult ADHD Self-Report Scale, that's what it stands for. It includes questions about inattention and hyperactivity. It can be used both as a screener, it can be used at baseline, before starting treatment, and also monthly for reassessment. But one of its limitations, keep in mind, is that it's a symptom frequency scale. So how often does this happen? How often do you get distracted? How often do you interrupt? How often are you inattentive? Those are just some of the examples. But it's not a functional measure. It doesn't ask, how does this affect you in your home life, in your social life or social circles? Does it affect you at work? So it is only for symptom frequency, not functional impairment. Something that is for functional impairment is brief A. Now, this one stands for Behavioral Rating Inventory of Executive Function, and A stands for adult. This one does measure working memory, initiation, planning, organization, emotional controls. Very, very detailed. As you can tell, even the diagram there seems overwhelming because of all of the aspects of ADHD that it measures. Um, Now, unfortunately, this one is proprietary information, so you do have to purchase it, so it's not freely available online, mostly used in research. And if you do read any primary research articles, if they mention Brief A, they probably had some grant funding to help out with it. This is not one that you're going to commonly experience yourself when you go to mental health provider. One that I do want you to know about, though, is the WISE Functional Impairment Rating Scale, or the WFIRS. This one is available in the public domain. And honestly, very underutilized. This one does measure the impairment, like I was talking about, the ASRS doesn't, it's just symptoms. The WFIRS does measure functional impairment in 4 different domains. This is great. It's not just at work, home, or social, also self-concept. That's one that we often forget to ask about. So if you are looking for improvement in symptoms, ASRS is going to improve first. But remember that function actually lags a little bit. So keep asking those functions questions if you're a provider or if you have ADHD yourself. Keep working at it because function lags behind symptom reduction. I do have a link here for a way to access the WFIRS online for free. And I can also send that out in the email after the presentation. These ones we use all the time. If you're familiar with any kind of intake paperwork at a psychiatrist or therapist's office, you've probably filled them out. PHQ-9 is a measure of depression symptoms, and GAD-7 is a measure of anxiety symptoms. Why are these important when we're talking about ADHD? Well, depression can mimic inattention. In fact, one of the questions on PHQ-9 is about focus and concentration. Have you struggled in the last 2 weeks with focus? Um, so people can think it's inattention. They can think it's ADHD when really It may be an underlying episode of depression. Anxiety can cause cognitive overload, which can then lead to inattention. And emotional dysregulation, it can be hard to tease apart from generalized anxiety. Is this from ADHD or is this from anxiety? There's a big overlap there with symptoms. So if we're being thorough and if we're being consistent, providing measurement-based care, we really need to include these measures as well. And what do we do with them? Well, once we have a clearer diagnostic picture, then we can then address it with tools and medications if needed. So, if we do have a co-occurring diagnosis of major depressive disorder, generalized anxiety disorder, a trauma, which is PTSD or related disorder, those can be treated, right? If it's another medical concern like obstructive sleep apnea or other sleep disorders, those need a referral. If there's ongoing substance use, we need to address that as well, as it can mimic ADHD. If there's thyroid dysfunction, hyperthyroidism often looks like ADHD, and hypothyroidism often looks like depression. So, if we're truly talking about ADHD, remember, it's not just the current symptoms, but we also have to take look back at developmental history. This is a neurodevelopmental disorder that starts in childhood. It can be hard to remember, but it's really crucial that we do a good job of discussing childhood history. It does have to have cross-setting impairment, meaning it's not just something that bothers you at home when you're with your spouse or with your family. It's something that occurs regardless of where you go, work, out with friends, family, and again, also don't forget that self-concept picture of it, just kind of the opinion of self-esteem. And ADHD is a persistent pattern. It's lifelong, right? It starts in childhood and it's ongoing. It used to be that a lot of pediatrician would say that, your child is going to be, he or she will grow out of ADHD. That's not the case anymore. Yes, some of the ADHD symptoms can improve with age, but not so much that it's going to be completely cured or that it goes away. It's a persistent pattern. Um, and same for if there's periods of stress or burnout, say somebody's going through law school, you don't just get ADHD when you're in law school. It's something that you've had your whole life. Now the periods of stress can definitely exacerbate those symptoms, but they don't bring them on and cause ADHD. All right, so now let's get to the good stuff. I know you guys, if you're just joining, you actually are coming in right at the perfect spot because this is the high yield information I want you to take home. If you've been tuning out, then please come back and join us. I want to teach you 5 tools that you can take home with you and start using right away. Now, I didn't come up with these. I wish I did. I wish I was that clever and talented, but this is based on a therapist guide. This is a published, well-researched and documented workbook and protocol for mastering your adult ADHD. Now you know where the title comes from. It has 2 versions. There's a therapist guide and a workbook for clients. So it could be utilized directly in therapy. So there's lots of different sessions. It structures them. As you can see, there's an example of a session outline, how to go through it, like an hour session. But top 5 highlights of the whole book, okay, in the next 20 minutes or so. Let's go. Skill number 1, a weekly planning ritual. Ooh, so this is not just having a planner, okay? I have a planner sitting here next to me, 12 months, right? It's not just about like purchasing a planner at your favorite store. It's about a ritual. So it's the habit. I want you to think of planning as a behavioral intervention, something you do, not just something you have. It's not a personality trait. That's not something you're born with. It is something that you actively work on. And why is this important? It decreases your decision fatigue. What am I supposed to be working on? What do I do first? Can I do that tomorrow? It also reduces avoidance. I was like, oh no, I'm going to ignore that. I'm going to do this less difficult task first. And it reduces cognitive load. You don't have to remember all the 20 things you have to do. What does this actually look like? I want it to be actionable. So there's five steps. First, you look at your calendar review, right? You look at the page of the week. Now, the best time that authors recommend doing this skill, this weekly planning protocol, is actually at the end of your week. I know you weren't expecting that. So today is Thursday. Tomorrow is Friday. So if you work a typical Monday to Friday week and your weekends are off, Friday afternoons are typically time of least productivity. Unless there's a deadline that, right, that you're trying to meet by 5 p.m. Or midnight, that's different. But if it's wrapping up your week, oftentimes that 3 to 5 p.m. window, we're kind of slacking off. We're dreaming about the weekend, especially if there's a long weekend or a holiday weekend coming up. And we're distracted, detached. But that's a crucial time because we actually have the best recall of what we did this week, this previous week that's wrapping up. All of the tasks that we still haven't accomplished and that we need to be pushed forward, and kind of the hierarchy, the priority list. So the authors really recommend taking a time on a Friday afternoon, if that's your typical week, and adjust accordingly if you work different days. Um, Review your calendar from the previous week, what got done Monday through Thursday. Write down what still needs to be done. That's your task capture. Estimate amount of time that each task will take. Um, and if there's something that takes 20 minutes or longer, break it down into smaller parts. That's number four, task breakdown, until it is something that's 20 minutes or less. And then go ahead and schedule it. So this part a lot of people don't do. Instead of just having a to-do list of top 15, 20 things to do next week, break it down into each day that you're working and then further schedule it as if it's an appointment with yourself. We're going to be working on creating a blog post, or you're working on um, creating a report or a project, okay? And to tie in that case that we started talking about a little bit earlier, Dr. A feeling really overwhelmed with documentation for all of her clients. Instead of just dreading it, she actually schedules it in as protected appointment times with herself. That's okay. But the time is blocked. So now she has it on her calendar as a task. So that's skill number one. Skill number two. This is task decomposition, a fancy way of saying what's the very next step. It can be really overwhelming to look at the big picture of write a report or create a marketing campaign. Let's break it down into just the very next step. So instead of avoiding the whole big, large tasks, we break it down into the first concrete action that we have to take so that we can get started. And here's a few examples here on the bottom. Instead of writing a whole blog post, let's just create a 5 bullet outline. Now, the key here is that you want it to feel almost slightly too easy. I love this. I can relate to this. If I'm scheduling out my whole week and I have a big project, let's say even creating this presentation, if I told myself I have to create 36 slide presentation and present for an hour, that's overwhelming. Let's instead divide it into something so tiny and so small. Let's decide on the title. Let's decide on the resources that we're going to use to create this presentation. It almost feels too easy. Wow, that's great. Let's start it right away. Instead of a large task overwhelming us and leading to avoidance and procrastination, we define a small next action and, ooh, this is a little tidbit here, a 5 minute start. Start with just 5 minutes. This will help build momentum so that we can complete that large task in small chunks, chunk by chunk. All right, let's move on to skill number three, initiation versus motivation. I know a lot of the times we talk about, oh, we have to be motivated. You must be so motivated. You achieve so much. You must be so motivated. Well, that's a common misconception. Guess what? Your motivation comes after you've already did the action. You've done the action, right? It's kind of a feeling of accomplishment. That's the motivation there, not the other way around. This is a common misconception. People with ADHD often sit around and wait until it feels right, until I get motivated or I feel inspired. That's not the right way to look at it. In fact, the CBT teaches us that we need to flip it. First, do the behavior, use that as a behavioral lever, as buy-in. Okay, I got started, I got momentum going. Then we're motivated. So this is skill number three. This totally flips how we think about projects and things and long-term goals. So whether you have ADHD or not, that's another thing I love about CBT for ADHD is that actually it's applicable for everybody. If you don't have ADHD, you're just going to get that much better at planning your time and being less distracted. So use this tip, actually share it with people that don't have ADHD, because if they're sitting around waiting to be motivated, waiting to be inspired, guess what? That motivation may never come. First, start working on it. One great way to do this, and I do this with my toddler. I have a 3-year-old. I have a timer. We have a very visual timer. Let's start with just 5 minutes and give yourself, this is important, give yourself permission to stop when that 5 minute timer goes off. Guess what? This long, big, overwhelming task that we've now broken down into a 20-minute project, but still we have that resistance. We don't want to be doing it. It just feels hard. I don't like it. It's very challenging. I don't know if I have all the right tools. Give yourself just 5 minutes and permission to stop after those 5 minutes, okay? This is a trick. It helps if the timer is visual. Now, I know we all have timers on our phones, and take that with a grain of salt. What the authors really recommend is a visual representation of time. People with ADHD have that time blindness where we don't have a good idea of what is 5 minutes. If it's something visual, or even one of those hourglass timers that is going to expire, those are really fun too. What this does is after 5 minutes, it gives you a sense of accomplishment, a little bit of dopamine, and it builds that task initiation confidence. Hey, I'm the kind of person that completes something in 5 minutes. I'm the kind of person that I can rely on myself. I can count on myself that I'm going to be productive and I'm going to accomplish my goals. Now, does our brain remember that really it was only a 5 minute goal of a 20-minute project? That part is not as relevant, right? What we do remember is that the goal was 5 minutes and we did it for 5 minutes. Um, Tracking along with our case that we have been discussing, Dr. A now starts her documentation with just a 5 minute timer after lunch. And that seems a lot more feasible. And guess what? Gets her started. Now, if you continue past those 5 minutes, love it. Keep going. You got that momentum, but don't wait for the motivation. All right, so let's talk about skill number four. We're flying through these. If you have great questions, please write them down, put them in the chat, or if you have additional tips or tricks or things that have worked for you, share them with others. This is a great collaborative environment. We have people here that are interested about ADHD. If you have a good hack, please share it. I would love to hear about it. But anyway, here we go. Skill number four, distraction architecture. Ooh, what does this mean? Well, if we know that we have ADHD or that we get easily distracted, how about we create our environment so it's conducive for us to be productive, right? If we have a lot of distractions in our office or in our house, and we're trying to do something that's takes a lot of mind power and will, don't think of being distracted as a moral failing. Stop judging yourself and give yourself kind of the permission to say, hey, my environment's not conducive for me to study. If you're in a loud airport lobby or coffee shop, guess what? That's going to be a hard place to study. Instead, design your environment so that it supports focus and it's almost perfect place so that focus blooms, right? It's a fertile environment so that you can go ahead and get the task done, accomplished. How can we do this? So here's some practical tips. Oh, this first one is hard. Kick out your phone. Put it outside of the room. This is so hard. I don't know if I can do this one. You guys, I put my phone on Do Not Disturb for this presentation, and I'm already like itching to take it off so that I could look at it. What if I got an important text message or an email? Those feel so urgent, but they're really not. Guess what? They'll still be there. At the very least, the authors of this workshop or of the workbook do recommend that you put your phone on silent. Although I don't know, that's still hard. If it's within reach, put it in a drawer. Maybe start small. Maybe let's do some of those those hacks, those tips that we were talking about, start with a smaller project and work your way up to kicking the phone out of the room. Same goes for websites. Block ads, block anything that, or set a parental control timer, how much time you can spend on Instagram, Reddit, Facebook. I love this next one, visual minimalism, because I didn't think of this myself. Think about all the screensavers we have, all the background images. If they're visually very stimulating, bright, colorful, and just busy, full of text or full of photos, that can be overwhelming and hard and distracting for an ADHD brain as well. So consider making some changes there. And this last one, body doubling, oh, this has been so popular in the last couple of years. It doesn't have to be anything fancy. It's basically that's all it is. It's a double. It's another person that's working on their own project quietly, side by side next to you. If you need a good body double, some places you could do that. Be coffee shop, although be mindful of the distractions there, or local library, public library. So, if we just reduce the distraction cues, control the stimuli in our environment, the probability that we'll be able to focus goes up, right? So, these are different skills for ADHD that whether or not you're taking medications, we can still be treating ADHD. All right. This is our last one. This is skill number 5, external brain system. Ooh, I love this one because guess what? Your planner can't be your external brain system. This is just a place to store knowledge. But guess what? My planner is all empty. I'm not using it. If your planner is sitting empty and the pages are don't write them, you don't look at it, it's not an external brain. You still have all of your knowledge and all of your to-do lists and worries, they're still there. So where do we offload our clutter? Where does it go? So a good working memory or external brain system will be one single system. It will be visible and it will be routinely reviewed. Those are the top 3 rules, right? So a lot of people tell me about using their phone apps. On the phone, the Notes app, right? Oh, it's great. I always know it's a single system. It's always in my phone app, in the notes. It's very visible, right? So it checks that. But is it routinely reviewed? Think about the last time you looked through your notes. Um, Probably not. Is it something that you go back through and edit out or take things out, or as you accomplish, kind of simplify the tasks and take out the ones that are no longer applicable? Probably not. Same with taking screenshots. Oh, ADHD folks, we love this. We love taking a good screenshot of like, I need to remember this. It goes to your photos or it goes into some folder, but we don't review it. So if you have multiple systems, this is your sign to simplify it into just one. If it's not readily visible or accessible, this is not usually an issue. Usually it's something that we store on our phones. So let's be realistic here. And if it's not routinely reviewed, this is another tip. So a system that you don't review is not a system. It's just storage. So what would I recommend? Oh, this has been my latest kick. I got put on this system called Notion. I've been learning everything I can about it. It's so interesting. It's a place to store, basically brain dump everything. You could make notes out of it. You could make presentation. This presentation is from it. Research. You can link forms to it, how you signed up for this webinar. It can be your AI scribe. It can summarize your meetings. It can be so many things. So I'm actually really exploring Notion right now as my external brain system. But if you have a good one, drop it in the chat. I want to know about it too, because let's find the best one. Why spend the time, the energy, the money trying to find what else is out there when, hey, if somebody already has one that's working really well, let's let's share the knowledge. Here's how to integrate it. So Dr. A has 4 different systems. Whew, one for a calendar, one for a to-do list, it's not working. So if there's friction and inconsistency, if the systems don't talk to each other, you're more at risk for having conflicts or double booking yourself, missing tasks, forgetting to go pick up your kids at soccer practice because you also have a meeting. It's not efficient, right? And it's ADHD brain is going to not like that at all. Instead, recommended to have one system, all integrated, something you routinely review both for today, but next week, next month. So you're following through on your tasks and assignments. It's reliable, right? And you feel that sense of, whew, I can exhale. I don't have to keep it all together because the external brain got me covered. If there was something important I needed to be doing right now, it would tell me, right? It's reliable and you don't have to worry that you're missing something, forgetting something. So those were the five top tips from CBT for adults with ADHD. I want to make sure that we talk about what it's not. It's not insight-oriented therapy. I mean, there's lots of great therapists that will talk about delve deep into, do you understand your symptoms? Do you understand how you're contributing to them? How your problem's manifesting? Um, but they're probably not doing CBT for ADHD if they're doing just insight-oriented. It's also not generic anxiety CBT or CBT for any other disorders because it's so specific to focus and organization. These are not productivity hacks. So I don't want you to think that this is just an influencer somewhere on Facebook or Instagram, TikTok that just made this up. Like, look at my super organized closet. You can do the same. That's not it at all. This is research-based, evidence-based. This is published, replicated. This has been well studied. Okay. This is also not motivation coaching. So if you're looking for somebody that's going to be there in your corner, just saying, you can do this, you got this, stay on task. This is not that. This is systems. You have to be internally motivated to make a change in your life for this to be effective. Okay. This is structured, skills-based, and manualized. Like I said, it comes with a workbook. Here, we're going to walk through this session by session, chapter by chapter, and we're going to see improvements. And if you're not internally motivated to go to those sessions, to put in the work, to do the homework, and to make changes in your life, it's not going to be effective. And guess what? That's not a flaw of the program. That's a personal issue, right? So maybe you are looking for more of like coaching or insight or therapist, which is all great and very much needed, but making sure we're differentiating the two and knowing which one is good for what. Oh, let's talk a little bit about high functioning adults. Oh, this is hard. High functioning adults doesn't mean that they don't have ADHD. It's a common misconception. Just because you were talented and gifted program in school, you went to college, maybe have a PhD, maybe you're a therapist, right? Doesn't mean that ADHD is either gone or controlled. What happens with high functioning adults, it can often compensate with higher IQ. And we call this kind of like that cognitive buffer zone. But they're at higher risk for burnout because they're putting in more effort and they're endlessly planning, reorganizing, shuffling, putting in additional time. They're maybe putting other important personal self-care to the side. And so high functioning adults with ADHD actually at higher risk for burnout. They can mask using shame and I'm not good enough, that I need to be trying harder. They have perfectionism driven paralysis of I don't think I can do anything because it's not perfect. And they're stuck in these loops of unable to implement any changes. What we need to do here as professionals, if you're a mental health professional, is to validate the patients or the adults with ADHD, their strengths. Hey, you are good at this. We're going to name the hidden cost that ADHD is influencing in their life. So we're like, yeah, look, ADHD is really putting a lot of hurdles in your way, but you are still strong and you still have made it this far. So it's a very careful balance. But I don't want them to be discredited because the experience of having ADHD and still being high functioning doesn't mean that the symptoms are not there. In fact, they're probably very good at masking them. How do we adapt this protocol for those high achievers? We need to challenge those cognitive distortions. The all or nothing black and white thinking or perfectionism standards. We also need to be teaching them how to delegate. Well, this is so hard. Well, if I want to have it done right, then I have to do it all myself. That's not true at all. Delegation is a skill. If you want to be a good manager, it's going to take time to learn how to do that. We need to protect our boundaries of time, right? To making sure that if we are working an 8 to 5, that we are done at 5. We don't get paid extra or overtime if we are charting at home, if we are um, looking up additional research and homework at home. If we're a student, that's different. But if we are in a professional environment, a high achiever that is maybe salaried has a high risk of putting in endless amount of hours. But it's the system that's broken, right? So it's not the person. So we need to reframe that identity. It's not that there's something wrong with you and you're broken and useless. It's that the system that you have set up around you for your ADHD is not optimized. Guess what? CBT for ADHD can help fix that. Now, as a psychiatrist, what I do is medication management. So, should we just totally forget about medications? Not at all. No. Stimulants for ADHD can improve a lot of the ADHD symptoms. Inhibition, they can improve sustained attention, like the hyperactivity, sustained focus, and response variability. But that's not the full picture. Why do we still need CBT? Because medication does not reliably teach how to manage your time, how to plan, how to prioritize your to-do list, how to create those external systems, like, right, the external brain, how to create follow-through habits. So, my clients, my patients that are doing better with medications still come in and tell me, I still struggle with dot dot dot. And if you've ever talked to somebody with ADHD that had a bad experience with stimulants, they said, "Ugh, the dose was too high, they made me jittery, I had all these side effects, it was horrible. I'm never doing that again." Well, what happened there, odds are, it was a clinician that was not well versed with CBT and was expecting the stimulants to do 100% of the heavy lifting. So when the symptoms were improving, but the function was lagging behind, as we talked in the beginning of the presentation, they were, hey, just expecting that a higher dose would fix that. They were raising the stimulant dose without addressing the impairment in function, which should really be done through CBT, not through just a higher dose of the medication. And that eventually got that patient to be experiencing side effects. And sometimes that leads to completely abandoning treatment. That's not the outcome that we want. We want to have a good balanced approach where there's both medications and good skills training. That's what's going to help an ADHD adult. And the evidence does support this. There's lots of clinical trials that have used this protocol, CBT for ADHD, and I've also included adults that were on stimulants, on medications, and they have shown the results definitely confirm this. If you're doing medication alone, yes, there's improvement, but medication and CBT skills, even better. So a little bit about me. I've been talking about kind of my own practice and my own experience. I'm a concierge ADHD psychiatrist. I treat adults 18 to 60. I run ADHD Alliance of Minnesota. This is a new private practice, okay? If you guys haven't heard of me before, that's okay. Not many people have. I just started in January of this year, and I love working with ADHD adults. This is why I'm doing this workshop. I just want to share the knowledge and the expertise. What I really work hard on is being a really clear communicator, whether that's collaborating with other therapists or directly with the client. My panel size of clients is very small, and I do that on purpose so that I can give that personalized attention and really see the results, really seeing the improvement, not just the number of clients, right? But the quality improvement with each person, right? We want that. I specialize in ADHD evaluation and then medication management ongoing. So yeah, my scope is just ADHD. Guess what? That means I know a lot about ADHD, and this is what I love doing. So you're not gonna have me be bored of hearing about your ADHD. Talk about it for ages. All right, so let's talk about a quick summary here. The five tools that we talked about, because if we're not repeating and focusing and memorizing things, we're actively forgetting them. So you've probably already been overwhelmed, but let's talk about the five tools again. One, we talked about the weekly planning ritual. Make it a habit. We're targeting here to be prioritizing which tasks are important and planning our time, like making our to-do list into a calendar list, right? Of into an appointment with ourselves of when we're going to do it. Now, we're targeting here to be less overwhelmed and better executive function. The next tool we talked about was next action. Here, we're really targeting the avoidance. I'll do it later. I don't want to do it. It's too big. It's too hard. I don't know where to start. The outcome here we're targeting is more initiation. Let's make it so small. Let's make the task so almost too easy that it's really intuitive and a smooth ramping up process, right? We can get started, we get that buy-in, we get that motivation. The 5 minute rule, again, feeling like I don't want to do this 3 hour long project. Let's start with 5 minutes. Set a timer. You can see it counting down. If you can stay focused for 5 minutes, it's a good place to start. You build that self-esteem, like that's feeling of accomplishment. That's awesome. You have the outcome, you're going to keep going. Distraction architecture. If your environment is messy and cluttered and overwhelming, you're going to get distracted. And it's not a personal failure. We have to create the systems that are going to work for us. External brain. So this is where are you going to store all of that? And are you going to reliably review it and organize it? So if it's on your phone, if it's on an app, that's great. But make sure you're actively refreshing it, improving on it, and following through so that you're not ending up being double booked and stuck in traffic when you were really supposed to be across town like 2 hours ago. All right, key takeaways from today's presentation, and we're wrapping up here. Medication is necessary. Guess what? Yes, medication still works and it's great. It can get us a long ways, but it's not by itself sufficient. Residual executive dysfunction can still be there. And it's not just about increasing the dose, it's about also using our CBT skills. We need to be using measurement-based care, and if your provider is not doing this, then they're missing out. We need to measure not just the symptoms of ADHD, but also your function, right? Because that's honestly what probably got you into seeking treatment for ADHD is the impairment in function. Nobody's really going to go see a doctor or a therapist because they just easily get distracted. It's when your boss tells you you need to be paying attention and you forgot to do something critical and you get in trouble. When you have an impairment in your function, that's really crucial to look at, not just the symptoms. We need to know how to change our protocol when we have high functioning adults because that doesn't mean they have low impairment. Competence can really mask the impairments, right? They can be tricky, it can be hard to find it, but look past that, not just their degree or their status or their job title. Look about like actually their day-to-day. CBT works by externalizing what the brain cannot internally regulate. So it provides that scaffolding, that the tools and the worksheets, like step by step. How are we going to help your ADHD brain work when you have certain things that are just not neurotypical, right? So our Dr. A that we've been following along this whole hour, the function improved. And guess what? Actually, the depression questionnaire improved. Doesn't mean that we were treating depression, right? We were not increasing the antidepressant dose. We were talking about skills for ADHD, but the questions for PHQ-9 improved. The documentation compliance, so the work satisfaction and work performance improved, and just overall overwhelm at work decreased and personal life enjoyment improved. That's great. So imagine your own Dr. A client. Maybe it's yourself, maybe it's a family member. Imagine that transformation from current snapshot to where you could be in 5 months, 5 years. Pick one tool to start. I think even five can sound too many, but I gave you some to choose from. Pick one. All right. So I have a couple things on this slide. That concludes our presentation. This was awesome. I'm going to say that now let's go over to, we're going to stop sharing the screen and I want to see the questions here. I want to see what you guys are thinking about. So for I guess I can email this out. Sorry, I stopped screen sharing a little bit too quickly. If you found this presentation helpful, then I'll send out an email of filling out a questionnaire, filling out some feedback for me, because I want to know how I did. And also if you want any of those diagrams or links, I can include that as well. Awesome. Whew. Who wants to, I think somebody was talking. Did I interrupt somebody? Does anybody have any questions? I love this. I'm gonna stop recording so that maybe that is keeping somebody think of more questions while I stop the recording.